This case that I posted, and I talked about the fact that the root canal was done by an endodontist, and patient has had dental phobia, so the endodontist used nitrous. Nitrous wasn't working for the patient. Patient was telling me that she was crying while the endodontist was doing the root canal because she had dental phobia. She was fearful and she was feeling things and she wasn't comfortable at all, and the endodontist kept on going. And I showed you this x-ray, this angulation of the PA, I believe, or something like that. And people were making all kinds of accusations and stuff like that, saying that, hey, you're trying to make yourself look better. That endodontist also had done a good job, or what have you. Whatever you guys want to believe, that's fine by me. But I went ahead and found this case. You see, this case was a 2023 case, so I had to go 2 years back to find it. And I believe this was one of the angulations that I showed you. I told you, whatever you want to think, that's fine by me. Again, I'm not trying to boast, or as one of these clowns was telling me that I'm trying to toot my own horn or what have you. I'm not. I'm a storyteller. The story is told to me by the patient. I do some investigating myself. If I need to talk to the general dentist, I talk to general dentist and what have you. And when I put everything together, then I present a case. So this patient was telling me that she was in a lot of pain and very fearful when the endodontist was doing the work. She was crying. Tears were coming down her cheeks while the endodontist was soldiering on and doing the root canal. That was what told to me by the patient. Okay. I hate drama. And some of you guys, you love drama and you love to be clowns, I believe. But anyways, here is the work of the endodontist. As I said, she was so fearful that after the endodontist, she had such a terrible experience with this endodontist who did the root canal while she was crying. The patient was crying and feeling stuff and was uncomfortable, and the endodontist kept on going, that she didn't go to get the tooth permanently restored. So when she came to see me, this whole area was just filled with food particles and bacteria and what have you. And you can see there's a periapical relucencies forming. So she had done the root canal a year prior, and this whole area had been exposed to food and bacteria, saliva, fungi, viruses, all kinds of stuff that live in our mouths. All of our mouths. All right, so that's why we needed to redo the root canal for this patient. And you can see looks like a slight periapical relucency here. Again, I'm a storyteller. The patient tells me what's going on, and then I tell you guys when I present my cases. There's no boasting. All right, let me show you a different angulation of the tooth. This is another angulation of the tooth. And some of you wanted to see more angulations. I got one more angulation. This is another angulation of the tooth. This is not me. Again, this was done at the time a year prior, so in 2022 by an endodontist while the patient was crying and what have you. All right, so this was the endodontist's work. And then I put the x-rays next to each other and I said, I think I did a better job because, well, I sedated this patient. So that's what it should have been done from the beginning. When a patient has dental phobia, nitrous is for children. Nitrous is for kids. 4, 3, 2, 3, 4, 5, 6. You do a couple of fillings on them. Maybe you prophy, clean their teeth and prophy and what have you. 10, 15 minutes for kids. Nitrous is not for adults who have dental phobia. So I was able to IV sedate this patient and do it properly, and that's what I said. I said, I think I did a better job. than the endodontist under the circumstances, because I again believe that this endodontist should not have done what he did, what he had done, because he put the patient under so much pain and suffering. Patient was telling me that she was crying while the endodontist was doing the work. That should never be the case. If your patient is crying, you should not be working on them, and you should not continue to be working on them. So this was the job of the endodontist, and then I put the x-rays next to each other. Well, I used the different angulation, or I'm sorry, I used this angulation when I compared it to the outcome that I was able to achieve. Or let's compare it to now a similar angulation. Compare the two, this endodontist's work and my work. Again, I'm not trying to boast and say I did a better job. The endodontist did what he had to do under the circumstances, but those circumstances, they were created by this endodontist himself. He should not have put himself in that position, and worse, put the patient in that position. No patient should be suffering under our hands, under our care. So here we go. Similar angulations. Okay, so this was the job of the endodontist who did the root canal. Gap here. Again, doesn't matter. It doesn't matter. The gap here. But again, this should not have happened to begin with, because this endodontist put himself and the patient under such a terrible circumstance that he couldn't do his best. He couldn't do his best. So he couldn't do his best, so he suffered, and his patient ultimately suffered. All right, and this is what I was able to accomplish. And let's zoom out so you can see the difference. And the difference is right in the apical area. See, there is this canal here, but there was also another canal right there. And that's what I was able to get. And that's what I was trying to say. So let me zoom out so you guys can see the difference too. Again, I'm not trying to make myself look better. I don't need to. Why would I want to do that? I don't need to. I don't need this. I don't need to present cases. I don't need to spend the time. I can spend my time doing a lot better things than argue with some of you because of something that I said, and you magnify it and you make it sound like I was trying to boast or toot my own horn or what have you. This was done by the other endodontist, and this was done by me.